Hey there, I'm Dr. Jonathan Fu, and I'm a board certified emergency medicine physician, and I take care of patients in the emergency room and urgent care in Northern California.
I'm Dr. Jason Bay. I'm a board certified internal medicine doc, and I work in urgent care in Northern California as well.
Today, we're going to talk about a very common condition low back pain. Now, 4 out of 5 people will have experienced back pain in their lifetimes.
Yeah, low back pain is such a common condition that bring people to their doctors. Personally, I probably see at least one or two cases of low back pain every shift.
And that's why we're planning to cover what people need to know if they experience new low back pain. And we're going to go over the answers to some of the most common questions that our patients ask us.
Yeah, so Dr. Jonathan, what are some of the common questions that your patients ask you about low back pain?
Well, I get asked things like, why am I having this pain? Do I need an x ray or an MRI? Will this pain go away? Can I go back to walking or exercising? And is there any medication I can take to help relieve the pain?
Yeah, those are very common and good questions about low back pain. And I must say the straightforward answers to these questions are unfortunately not that easy to come by, especially online. And there's also a lot of misleading or confusing or just anxiety provoking informations out there. So, we're very excited to talk about back pain and give our viewers our evidence based and research backed answers to these questions. And before we go further, a quick reminder that we're providing this information for educational purposes only, and information we provide here should not be considered medical advice. And you should always consult with your health professionals about your specific symptoms and conditions. But we do hope that this video helps you better understand your back pain.
All right, so let's dive into it. One question we get is, why? Oh, why am I having this back pain? Or what is causing my back pain? Many folks come to us worried, and frequently they have already asked Dr. Google, what causes back pain? During their web search, they've come across some confusing and often scary terms and diagnoses.
Yeah, so I did this earlier today, and basically, what you get out of it is the back pain could be caused by literally anything, right? So possible
Mm.
causes of low back pain include spinal stenosis, infection, cancer, fracture, herniated disc, kidney disease, and ankylosing spondylitis, and many more.
Sounds like a dinosaur.
Yeah, I mean, yeah, ankylosing spondylitis sounds like a dinosaur, but it's a rare autoimmune disease. Anyways,
Mm.
the point
Yeah.
is that this long list of potential causes of back pain is actually not very helpful for most people. And not only that, this is not how we doctors really think about back pain, anyways.
So how do doctors think about back pain?
Yeah, so most doctors, including myself, are really trying to figure out, is this dangerous or not? In other
Mm.
words, we're just trying to figure out if this low back pain belongs to the great majority of low back pains that will go away on its own, or if it's caused by something more serious, and we really need to do more investigating to figure out exactly what's causing the pain.
Absolutely. In the emergency room, one of our main goals is to make this key distinction between dangerous or not. Tell us more.
Sure. So, for new low back pain, meaning a back pain that has started recently, 90+% of them will get better on their own just with time, usually within the first 4 weeks. And these back pains are
Mm.
caused by what we call mechanical issues like sprains or strains of the back or a disc problem.
Gotcha. So most new back pains will get better on their own. Sweet. Got it. But I think a quick primer on back anatomy may help us understand these mechanical causes of back pain better. The back is made of a series of individual backbones called vertebrae. Each vertebrae is stacked on top of each other, and there's an intervertebral disc between them. These act as shock absorbers.
Yeah, so these discs essentially work as like a suspension in a car, right? So they minimize the impact that jumping and landing would have on the bones of the spine, as well as the big heavy thing that sits on the top of the brain called, or top of the spine called the brain and the skull. So
Sure.
yeah, so these discs kind of remind me of my meditation cushion, which really has a tough fabric covering on the outside, and inside is like a jelly-like substance for a shock absorption instead of whatever seeds or grain that's inside the cushions.
That kind of reminds me, I should probably do a little more meditation. Make that a note to myself here.
Yeah, me too. And then exercise and being nice to family and all that stuff. Yeah.
All very good things indeed. Well, getting back to anatomy, each vertebra has three parts: the front round part, which is responsible for bearing weight, the middle part with a hole in it, which houses the spinal cord, and the back part, which has these spiky, bony protrusions where ligaments and tendons attach. It's this back part that allows the back to move, twist, and bend.
Yeah, and I think this is a good time to talk about ligaments, tendons, muscles, and how they all relate to sprains and strains.
Yeah, so a ligament is a tough, fibrous tissue, kind of like a rope or maybe some duct tape. It forms a bone to bone connection and keeps movement of a joint to a safe range. When a ligament is stretched or partially torn, it is called a sprain. The most common form of this I see is after car accidents when a patient experiences whiplash. The ligament fights to keep the neck stable, but they are fighting against forces of the car, and that's just too much. They get injured.
Yeah, another good example of a sprain is when you roll an ankle. So when you roll
Hmm.
an ankle, the ligaments fight to really keep the bone from falling apart and breaking, but they do get stretched in the process.
On the other hand, strain is an injury to the tendon, which is more like a rubber band that connects muscle to bone. When this gets stretched, it's called a strain. I see this a lot in people trying to lift weights a bit too heavy for them, or like me when I try to swing a golf club a little bit too hard.
Yeah, me too. Awesome. So let's we now that we got sprains and strains out of the way, let's not forget about the nerve roots.
Hmm.
So two bundles of nerves really exit through a very narrow space created between these two adjacent vertebrae, and this is how nerve endings from the muscles or the skin or the bladder connect to the spinal cord and ultimately to the brain. But because this space is quite crowded, it's really
Hmm.
easy for these nerves to be compressed. And then when they do get compressed from the outside, they can get quite irritated. And this happens frequently. If there's a herniated disc or an arthritic bone. Um, so, Dr. Jonathan, do you want to explain what a herniated disc is?
Yeah, sure. So herniation happens when something inside protrudes through an opening that is not supposed to be there. So, for example, an umbilical hernia is when some inner fat or intestine pops through the belly button. With a disc herniation, the jelly like substance inside of the disc protrudes through a weak spot in the outer covering of the disc. This puts pressure on the nerve root that passes nearby.
Yeah, and the disc problem doesn't really have to be a herniated disc, but it can be a wear and tear of the disc called degenerative disc disease.
Yeah, degenerative disc disease. I get asked about this all the time by patients who've gotten an x ray on this or that part of their body, and they see the radiology read says degenerative changes. This worries them a lot. This basically just refers to changes with aging or wear and tear. Just like your car tires start to get small cracks or rough edges over time, the same can happen to our bones or intervertebral discs.
Yeah, so that was a lot. So just to summarize, low back pain. So the great majority of new low back pain is mechanical in nature, meaning that it's caused by a back sprain or a strain or a disc issue, and not cancer or infection or fracture, as some Google searches may have you believe. And back sprains and strains usually occur because of a trigger, like lifting a
Mm.
heavy bag of soil or sitting in an uncomfortable position for a long time, for example, in an airplane. Sometimes people feel the back pain right away, and other times it can take a day or 2 or 3 after the triggering event.
Yeah. Usually patients can tell, oh, yeah, I did this, and that probably caused the pain. But a good proportion of patients also have nothing they can think of. But regardless of the cause, these mechanical back pains are usually better with rest and being still and get worse with movement.
That's totally true. So, depending on the exact cause of it, you know, it may be bending forward or bending backward or leaning in a certain way, but usually movement makes the pain worse. And muscle
Mm-hmm.
strains with the T tend to be crampy or feel like spasms, whereas a herniated disc can cause a shooting pain down that nerve. And most people probably have heard of the term sciatica, which is exactly what happens when the sciatic nerve gets irritated and causes the pain that shoots down the buttocks and the legs.
Yep. So, all these different types of low back pain are considered mechanical. Let's take a look at the data. According to a review article in the New England Journal of Medicine, which is kind of the most prestigious medical journal in the world, 97% of all low back pain is due to a mechanical cause.
Yeah, so here I just want to point out that according to this study, that cancer or infection as the cause of low back pain was really quite rare. So, for example, cancer was responsible for really less than 1% of all back pain cases, and infection really about 1 in 10,000 cases. And autoimmune diseases like ankylosing spondylitis or psoriatic arthritis are also very rare at 0.3% of all low back pain cases. And we'll go through some of these more, concerning causes of low back pain later when we talk about red flags.
Yeah, so you mentioned that almost all of these mechanical back pains get better on their own, and we don't really have to do any big evaluation. That seems a bit too good to be true, huh? Could you tell me more about that?
Sure, sure. Yeah. So good news is that, for most people with a new back pain, it almost always gets better with time. So there's
Mm.
this one paper that showed that among the people who went to their primary care doctors for new back pain, 9 out of 10 had a full recovery within 2 weeks. And in
Mm.
another study, even among the patient who went to an emergency room for back pain, presumably because their pain was more severe than those who went to their primary care doctors, their pain level subsided by more than 40% within a week on average.
It's pretty impressive.
Yeah.
But what about herniated discs?
Yeah, even herniated discs, which are a major cause of a back pain, seems to really heal spontaneously if really given enough time. So
Mm.
another study showed that nearly two-thirds of herniated discs that were confirmed by MRIs had a partial or complete resolution when they were repeated several months later.
That's pretty awesome.
Yeah,
I like to kind of imagine the discs sort of sucking the gel back in.
yeah, it's like,
But yeah, exactly. Well, to summarize what we discussed so far, most new low back pains are because of sprains, strains, or disc problems. And regardless of exactly which of those is causing the pain, they all seem to get significantly better within a few weeks. Does that sound right?
yeah, exactly. I mean, obviously there are some exceptions to this, especially if there are any red flags, which we'll talk about shortly. But in absence of these red flags, we do not really need to do more testing, such as X-ray or an MRI. So I think, it's really a great time to segue into the next common question we get from our patients, which is, do I need an X-ray or an MRI? Dr. Jonathan, how common do your patients ask you this question?
Oh, all the time. This is a very common question. And thankfully, we have pretty straightforward answers because medical experts are pretty much unanimous in their recommendations here. They
Yep.
advise against getting x rays or MRIs for low back pain that have been around for less than 6 weeks, unless there's a specific reason, we call them red flags, to believe that something more serious is going on here. For example, the American College of Physicians, which is the leading medical society, recommends do not perform imaging for low back pain in the first 6 weeks unless red flags are present. Red flags include, but are not limited to, severe or progressive neurologic deficits or suspected serious underlying conditions such as osteomyelitis.
Yeah, so I think this is the point that most viewers are probably confused about. Isn't more information always better, right? Why would you not get an imaging study if it's going to show what could be wrong with the spine and what might be causing the pain, right?
Yeah, no, absolutely. There are really two reasons to not get an imaging study for low back pain if there aren't any red flags. The first reason is that these studies don't really help with deciding what to do next. When you're training as a new doctor, we really learn to ask the question, how is the result of a test going to change management? Or are we going to change the treatment based on the results of the test? For most low back pain, because they get better on their own with time and proper care, these imaging studies don't really give us more guidance. In essence, it's a waste of time and money. Now, the second reason we don't get imaging studies is probably a bit more important. They can actually be harmful.
Yeah, I imagine for most people that's pretty shocking to hear. So can you tell us a little bit more?
Yeah, so modern MRI and CT scans are just so good at capturing even the smallest details of our bodies, even normal signs of wear and tear in the spine that aren't causing any pain will show up on these scans. And when researchers looked at people who had a lumbar MRIs done, those people that had no pain and no history of back pain, they found that 20% of those under 60 years had major spine abnormalities like a herniated disc or spinal stenosis. And in those over 60 years old, over half had imaging abnormalities. Again, these people are people with no back pain and who did not need any treatment.
Got it. So I just want to summarize what that means, which is that, because you see something abnormal in the back MRI, really does not mean that whatever you find is necessarily the cause of the back pain, because people with no back pain seem to have these abnormal findings too. Does that sound right?
Exactly. Yeah, exactly. And the problem is that when people got these MRIs unnecessarily, they were 15 times more likely to get a spine surgery. And down the line, these studies found that they actually had more pain than those who did not get one of those MRIs in the absence of red flags. So we really try to avoid getting them unless the symptoms have been there for over 6 weeks or if there are any red flags which tell us we should be more concerned.
Yeah, so let's talk about these red flags a little bit. Um,
Okay.
so the red flags of low back pain really tell us either the spinal cord is in serious trouble, or that the back pain may be caused by a serious underlying disease like a cancer or an infection. And I think most people here are aware of what could happen when a spinal cord gets severed in a trauma, like in a bad car accident. Essentially, the nerve
Mm-hmm.
below the level of the injury cannot communicate with the brain anymore, so that these injuries usually lead to people being paralyzed and wheelchair bound.
Yeah, I think Christopher Reeves, who played Superman, is a pretty famous example of that kind of injury.
Yeah, exactly. And this kind of irreversible damage to a spinal cord can happen if it's severely compressed for a long enough time. And these often happen because of a massively herniated disc in the low back, but it can also happen from a tumor, infection, or bony growth suppressing on it for a long time. So this condition is what doctors call cauda equina syndrome, where people have weakness and numbness in both of their legs that get worse over time, in what doctors call progressive neurologic deficit.
So essentially, the nerves and their blood supplies get choked off, and communication between the brain and the legs is disconnected.
Yeah, exactly. And in this condition, people often get abnormal feelings in their pelvis, inner thigh, and groin, and can also have bathroom accidents like leaking urine or stool. And this happens because the nerves that supply the skin in the pelvis, as well as the bladder and the rectum, stop functioning eventually.
Yeah, pretty serious stuff. What do you do if once cauda equina syndrome happens?
Yeah, so this condition is a surgical emergency, meaning that the spine surgeons usually have
Mm-hmm.
to go in and operate and physically remove whatever that's compressing on the spine. But thankfully, it's quite rare, and it represents less than 1 in 1,000 cases of back pain that are seen in primary care's doctor's office.
Well, that's good to know. Severe back pain with worsening weakness and numbness of the legs, or new difficulty controlling bowel and bladder function, is an emergency, and that should prompt you to seek medical care immediately. Any other red flags we should know about?
Yeah, so other causes of back pain we think about are cancer and infection. Again, these are rare, at rates less than 1% of all back pain cases, but we think about them and usually do additional tests like X-ray and MRI and lab work if they have any unexplained fevers, chills, or weight loss associated with the new back pain.
You mean anybody with a fever and back pain? I think we'd be MRIing everybody with the flu, Jason.
Yeah, I mean that's what I said. Unexplained fevers and chills with back pain. So
Okay, fair enough.
we usually think about ordering an imaging study if the patient has a pretty severe pain and any history of cancer, especially if they have an active cancer. We also have a low
Mm.
threshold to get an imaging study if they're at a high risk of infection um, because either they're severely immunocompromised, for example, they had an organ transplant, or if they actively use intravenous drugs.
Got it. So fevers, chills, weight loss with back pain, especially if they have cancer or are immunocompromised. So you mentioned that musculoskeletal back pain tended to get better with rest and was worse with activity. How about cancer or infection pains?
Yeah, so these pains happen because either the cancer or the infection is infiltrating or eating away the spine. So they tend to be quite localized to one specific point in the spine, and they're not necessarily affected by rest and movement. But uh, some musculoskeletal pains, like a sprain, can be localized to a specific point and may not be better with or made better or worse by movement or rest. So, this characteristic alone is not considered a red flag.
Gotcha.
Yeah, so finally, the last set of red flags are concerned with the risk of a fracture. So, if there's any significant injury, like a fall from a high place, a motor vehicle accident, or if the patient has a history of osteoporosis, which is a disease of weak and brittle bones, then we often get an X-ray or CT to make sure there's no fracture.
Great. I think that's all the main red flags. The only thing I would add here is that if the duration of the back pain is more than 6 weeks, then that's another time that we would consider getting some imaging studies.
Yep, great. Thanks for adding that important point. So let's switch gears a little bit and talk about what people can do for their back pain. And I think this is also a great place to remind our viewers that in absence of any of these red flags that we mentioned, most new back pains do get better with time.
Yep.
Okay, so let's start with some over-the-counter pain medications. Dr. Jonathan, what do you recommend that your patient take for their back pain?
Yeah. So non-steroidal anti-inflammatory drugs or NSAIDs like ibuprofen or naproxen, better known for their brand names Advil, Motrin, and Aleve, are usually more effective than acetaminophen or Tylenol. I usually recommend NSAIDs over acetaminophen as long as they don't have a reason not to take them, like heart, kidney, or bleeding issues. In those cases, acetaminophen tends to be the safer option.
Yeah, I agree with that. And I routinely recommend over-the-counter pain medications like ibuprofen or acetaminophen. And studies show that NSAIDs like ibuprofen can increase the chance of recovery by about 20% after a week. But it seems to reduce the pain level only about 8% in a week, which is not that
Ooh.
much. Yeah,
Yeah.
and another question that I get asked about is about activity. So should I be resting and staying in bed, or are there any exercise that I should be doing? What are your thoughts on that, Dr. Jonathan? And more importantly, what does the data show?
Yeah. So back in the day, doctors used to recommend bed rest for patients with new back pain, even as recently as the 1990s. But studies have shown that staying in bed actually slows the recovery process. Now we recommend not staying in bed all day. That doesn't mean you should go running or lifting weights. But I think avoiding all activities is more likely to hurt you than help you.
Yeah, exactly. And then you mentioned exercise. Let's talk a little bit about that. So, do exercises help? If so, which one should they be doing?
Yeah, there are numerous exercise programs for back pain, and they often focus on range of motion, stretching, and strengthening of the core and of the lower back muscles. As the saying goes, motion is lotion for the spine. Exercises that strengthen the core seem to be effective in people with chronic or long term back pain, as the muscles help support the spine. But there isn't any great strong evidence that it helps in people with new low back pain.
Got it. So, it sounds like data suggests that lying in bed all day is not great, and doing
Mm-hmm.
exercises, as long as they don't really cause a lot of pain, may be okay. All right, great. How about ice versus heat? Which one works better for low back pain?
Yeah, well, studies actually have been done to look at this, and they show that heat can be quite effective in relieving new back pain and can reduce the pain by 20 to 30%. On the other hand, applying ice on the low back hasn't been shown to be quite as effective. So if you had to choose one, I would recommend heat over ice based on the studies. But I often tell patients to try both and stick with what makes them feel better.
Got it. Um, how about massages, chiropractic adjustments, and acupuncture? What are the evidence for
Well,
these?
hmm. Well, there is some evidence that massages help for chronic back pain, and they also feel great. But for new back pain, unfortunately, there aren't great studies showing benefits of acupuncture, chiropractic adjustments, or massage.
Got it. Okay. So I think we've been talking so far about over the counter medications or what people can do at home. But sometimes the pain is so bad that it interferes with everyday activity or sleep. And that's really when people come to see us at, urgent care or emergency room. So maybe we can briefly talk about what pain relief options that we doctors can provide.
Yeah. So the first thing we can do is prescribe a medication that can help with back pain. Although the recommendation is to limit the use of narcotics or steroids for back pain unless absolutely needed. They come with some significant side effects. The class of prescription medications with the strongest data for effectiveness is muscle relaxants like cyclobenzaprine, commonly known as Flexeril. This is probably because a significant portion of back pain is due to muscle strains and spasm. There are also injectable NSAIDs like ketorolac or Toradol, which can give people some good relief. If there are any tense and very irritable muscles in the back, a trigger point injection can be helpful as well. Doctors insert a thin needle at the spot of maximal tenderness to help release the tension and sometimes inject a small amount of numbing medication like lidocaine. There isn't a great deal of evidence for its effectiveness, but it's a procedure with pretty small risks. And I've had some great success with it for patients in the emergency room.
Got it. Well, that's it for back pain. You can find the links to the research studies that we discussed in the video description. Well, if you found this video helpful and want more videos like this filled with scientific evidence and practical information from practicing doctors, please hit that like button and subscribe to our channel.